call? What's your name?
Denise.
Okay, you want to be called Denise?
Yeah.
Okay, so I'm here to get you out of bed. I heard that your surgery went very well this morning.
Considering that my innards are no longer with me, I sure.
Yeah, you did have a hysterectomy, but we got to get you out of bed. So,
Say what?
well, they did explain to you before surgery that you would have to get out of bed right away.
No one told me nothing about getting out of bed on the day of surgery.
Well, I wish that would have happened. I don't know why it didn't, but the bottom line is I have to get you out of bed. So,
you can put the side rail down all you want. I ain't going nowhere.
well, with all due respect, I know that, you don't feel like getting out of bed, but I have a lot of other patients to see. I haven't taken my lunch. It's not gonna hurt. Just come on, let's go.
I don't believe you, and with all due respect, I'm not getting up out this bed.
Oh, come on, chop chop, let's do it.
Chop, chop.
Yeah.
Girl, get off my covers. I'm staying in bed. No one told me nothing about getting out this bed. Not doing it.
All right, have it your way.
Alrighty then.
Do you have your call bell?
Yep.
All right, see you
All
later.
right. See ya.
My name's Shannon, and
Shannon.
I'm one of the PACU nurses. I just wanted to come in to talk to you to explain a little bit about what to expect after surgery. So you'll be in PACU for maybe an hour and a half to 2 hours, recovering, and then you will go up to a med-surg floor. And after that time, usually within 4 hours, they will get you up out of bed. And I know that sounds like
On the first day?
very scary. Yes, the first
What?
day.
Can my body do that?
Yes, providing there are no complications during the surgery, they'll usually medicate you, so you won't have any pain, and you may just ambulate 10 to 15 feet just to the bathroom.
I'm gonna tell you, you're gonna have to drug me up to get me to do this.
Okay. All right, I just want you to be aware of the expectations so you're not shocked after surgery.
Yeah. Someone's gonna have
Okay.
to remind me of this conversation. I'm
All
not
right.
gonna lie.
Okay. All right, that sounds
And
good?
I really need some drugs.
Okay.
Hi Denise, I'm Robin, I'm your nurse today. Hi, how you feeling?
Drugged up.
Yeah? I heard your surgery went well. There are no complications at this time. So you were medicated a little earlier for pain, and just like they talked about in preoperative teaching, that we would like to get you out of bed as soon as possible. So I think now is a good time where you've had some pain medication. When you get out of bed, it'll be a little bit less comfortable, but there is gonna be some discomfort. I'm not gonna be dishonest with you.
No, I told Shannon to have y'all drug me up. You drugged me up. I can do this.
Okay, so the first thing I wanna have you do is I'm gonna have you put your legs over to the side of the bed and just sort of sit for a minute. We wanna make sure that you don't feel lightheaded or dizzy, anything like that. Very good. Okay, now you're just gonna sit here for a minute. We wanna make sure that you don't feel lightheaded or dizzy. Do you feel comfortable, I'll be walking right with you.
Can I get a walker or something?
Yes, yes, absolutely. If it makes you feel more comfortable to walk with a walker, we can do that. And I'm gonna be right by your side. And I wanna let you know that we're not gonna be walking too far of a distance. I wanna walk over to that sink and back. And that will be all the walking that you do for now. Do you feel comfortable with that?
Yeah, sure. Let's
Okay.
get this over with.
How do you feel? Do you feel lightheaded or do you feel comfortable?
I mean, they just took out my uterus, so,
Okay, like I said, you are gonna have a little discomfort, but getting out of bed earlier will help you get out of the hospital sooner.
all right, let's do this.
Okay. Very good. All right, like I said, we're only gonna walk to the sink and then back. Very good.
Is that what you tell everybody?
Mostly everybody that does a good job, but you have to be doing a good job.
All right.
And when your family's here, they can walk with you too. The more walking you do, the better off you'll be. Be a hero. Ambulate on day 0.